There we go. So the first thing that I want to let you know is that this is a pilot study, meaning that we don't have any sort of control arm and we don't have any sort of placebo doses. So we know when people are coming in that they're getting psilocybin, and we've so far had 15 participants lined up, and most of them are through at least their first psilocybin session. Actually, we have one lady who will be going through her first session next week. And this is the pilot study to assess the feasibility of treating nicotine addiction using psilocybin, along with a few other elements that are combined in our approach. Among the 15 participants that we've gotten so far, there are 10 male, 5 female, and with a mean age of about 51 years. And they smoke an average of 20 cigarettes a day, or about a pack a day. And they have been smoking about that much for around 30 years. And that is kind of a snapshot of our participant sample, the people that we've been running. So these are fairly heavy smokers, people who've been smoking for a long time. And our protocol, it consists of 15 weeks of counseling meetings, as well as 3 psilocybin doses, moderate to high dose. And we have those spaced out at 5, 7, and 13 weeks post the beginning of the treatment. And most of our counseling is actually cognitive behavioral based, meaning that we talk a lot about thoughts and behaviors that are related to smoking and how that works and how we think people will be best able to cope with craving and temptation to smoke after they quit. So the good news is so far 91.6% or 11 out of 12 of our participants have quit smoking. So a little caveat, I said that there were 15 participants, but we'll be mostly talking about 12 of them today who have made it through the quit process. 2 of them quit last week, and 1 of them is quitting, like I said, next week. And so since it's so early, it's best not for us not to really have any data to talk about them yet. But for the main study presentation, our principal investigator, Matt Johnson, will be speaking on Sunday in the clinical track at the East Hall. So if you'd like to hear more about this study, then I would direct you to Matthew Johnson's talk on this study, and he'll talk a little bit more about the primary outcomes. So what I'll be talking about today is the potential psychological mechanisms of action that are going on in the psilocybin facilitated treatment. To briefly orient you, volunteers are first cleared through a pretty rigorous psychological and physical screening process, after which we will go through 4 weekly meetings, which are basically counseling meetings where we get to know one another, we build a sense of trust and rapport, and at that point we also set the quit date, which is the first psilocybin session. The 8 to 10 hours that we spend beforehand, like I said, is very important in building that trust and rapport, which is useful for having more profound and safe sessions under the influence of psilocybin, of course. So after the participants have quit and after their first session, we asked them whether the psilocybin had helped them to quit smoking in their opinion, and if so, how. And these data were collected in self-report questionnaires roughly between 1 and 2 weeks after their quit date. So participants were asked, as I said, how did they think the psilocybin helped them to quit smoking? And we present them with a list of options. These are kind of our best guesses of how we thought it might be working. And so these are the 5 options that are on our questionnaire. And there are also 2 other responses, one being that the psilocybin did not help them to quit, and the other being an other response where they get to write in their own responses. This is a sort of circle all of that apply scenario. So we have 83.3% of respondents saying that they thought that the psilocybin helped change their orientation toward the future so that long-term benefits would outweigh the immediate desires to smoke. And so that was the most popularly endorsed reason that psilocybin was able to help them to quit smoking. And as you see in descending order, we also have that psilocybin supposedly helped them to strengthen their belief in their ability to quit, It helped them change their life priorities or values, such that smoking was no longer more important than quitting. And it also helped them to reduce stress involved with quitting, as well as reframing quitting as a spiritual task. So again, these were the items that we gave them and that they endorsed in that order. None of the participants responded that the psilocybin session was not useful in quitting smoking, so that's also good news. Some of the other reasons that they did give us were that the psilocybin sessions increased their awareness of the addictive process, that the psilocybin sessions had given them increased determination to quit, also that they had a sense of greater space or distance between smoking cravings and their behavioral response to those cravings. And kind of like to think of that as the cravings you can see them coming, is what the participants say, and when they have that extra sense of space, they're able to react in a way that's novel, so not picking up a cigarette and smoking it. And finally, one of our participants wrote in that by exploding the awareness of the preciousness of existence, voluntary choices of unhealthy practices are diminished, which, of course, was one of the ones that we forgot to add to our list, but it's... So beyond the self-report asking participants why it is that they thought the psilocybin helped, we were also taking measures from the smoking literature that would help us to pinpoint some of the corollary psychological processes. And as a caveat, we do like to keep in mind that there are obviously some biological processes going on here, since psilocybin is a serotonergic agonist. But we haven't started to look into that quite yet. That's something that we're looking forward to examining further in the future. But as of right now, we're kind of confining our view to some of these psychological processes. And what we found with the assessment data is that people are reporting increased confidence in their ability to abstain from smoking after their psilocybin sessions. And people are also reporting decreased craving, decreased temptation, desire, and intention to smoke after their psilocybin session. So I would like to show you some of that data. So here you can see this is from the Smoking Abstinence Self-Efficacy Scale by De Clemente et al. And you can see there that there's a general downward trend in the temptation to smoke. And where is that line right here being the first psilocybin session, and this line right here being the second psilocybin session. And there's, of course, a trend towards the less and less temptation to smoke. And you can also see in this other graph here that our participants are showing increased sense of confidence in their ability not to smoke after their psilocybin sessions. I'm sorry? The units are based on items and their ratings of these items. So an example of an item would be, how tempted would you be to smoke when at a bar or cocktail lounge, on a scale from 1 to 5. And so that's what their scores are representing. Yeah. So in their own words, the participants are describing some of these processes as well. For instance, our participant number 1, who's a 26-year-old female, said after that during her first session, quote, "I saw an image of my lighting a cigarette and saw that image duplicated many times over and tried to count all the cigarettes I've had in my lifetime. I tried to remember specific ones, but mostly I just kept coming back to that one image duplicated and saw that there's no such thing as just one. One cigarette is never enough, 1,000 is never enough." So we can see how such an insight might play into having a decreased temptation to smoke, in the sense that there's no satiety that comes from smoking. Participant number 2, along the lines of confidence, remarked simply after his first session that, "I am confident and content to be who I am. I am confident and content anything feels possible." So again, this shows an increase in the sense of self-confidence, which is not just related to smoking, but obviously it can carry over into that. So here's some more of our preliminary data regarding craving. And so this is from the Wisconsin Smoking Withdrawal Scale. And this is a graph of participant responses to their craving subscale. And as you can see, again, there's a general kind of downward trend here in that direction for people between their baseline and post-1 and post-2 psilocybin sessions. You do see there is one outlier here, and that actually happens to be the one gentleman who did not successfully quit smoking after going through the protocol. And as a caveat, we would also like to say that unfortunately, that gentleman was forced to leave the country on an international business travels, and as a result of that, he missed 2 months of the treatment, the last 2 months of the treatment, and the third psilocybin session. So we suspect that might have something to do with his, his trouble in staying. He also did go from smoking a pack plus a day to smoking 5 cigarettes roughly a month. So it's not necessarily a failure, but in terms of an abstinence-only model, then of course he was still smoking at that time of the follow-up. And again, in their own words, the participants, when describing their experiences, say something that is very congruent with what we're getting with our measures. For instance, after facing challenges within the session, coping with some intensely uncomfortable physical sensations and great anxiety, I was left feeling empowered to deal with any possible future cravings concerning smoking. During the session, I felt as though I had already completed my withdrawal from smoking. I felt that all the work had already been accomplished. I felt amazed, grateful, and giddy about everything being so simple. And participant 12 likewise said, with regards to smoking cessation, when the thought occurs that I'd like one now, it seems that the craving need can be easily overcome, that by shifting my thoughts to the intense, vivid, enlightening experience during the session, distracts me long enough to stop thinking about the cigarettes. Also, deep breaths and Altoids. So we definitely had found that a lot of our participants pick up chewing gum, smoking, eating carrot sticks or pistachios, a lot of substitute behaviors to ease them into the transition of going from smoking to non-smoking. Because as you can imagine, it can be fairly jarring to go from a pack-a-day habit to 0 cigarettes a day. So here we have some more of that data we were talking about. This is from the questionnaire on smoking urges, and again you can see just general downward trend in the intention and desire to smoke pre and post psilocybin sessions. And participant 6 said, speaking of addictions, I don't miss smoking and I have no desire to ever smoke again. I'm experiencing some anxiety but seem able to cope. Interestingly, I did not seem to go through any symptoms of withdrawal, nor was I actively seeking to replace normal smoking habits. I simply became a non-smoker. Thank you. And so as you can see, again, the desire to smoke, for whatever reason that we're still unable to pinpoint at this time, is in some cases really just going from a normal smoker level to a non-smoker level overnight, basically, or over the course of the one day that we do our psilocybin session. So it's definitely encouraging results to see that these people are having such positive outcomes from the treatment. So beyond what we're able to measure with instruments and assessments, there are some other smoking-related insights that are coming up under the influence during people's sessions. So for instance, one participant said that during his second session, situations in my life which were painful or difficult were revealed to me. I instructed myself to delve into it. I seemed to develop a profound sadness where I cried, and the crying seemed to cleanse each instance. At the end of each of these instances, I seemed to emerge as a diamond from the darkness, getting brighter and brighter until exploding as a burst of light, which cleaned everything around me and covered everything with goodness and love. I realized that I was holding all of these issues in the cigarettes that I had been smoking and slowly poisoning myself with this pent-up emotion that I had been hiding from myself for so long. By letting go of the smoking, I was in fact opening up to the world again and revealing the real me. So again, you can see that beyond some of the normal psychological mechanisms like temptation to smoke or craving that we were examining, there's some other emotionally cathartic experiences that happen under the influence which are directly related to the smoking habit, and which seemed to be very helpful for these individuals in giving up the smoking habit. So aside from smoking-related insights and smoking-related content in the sessions, we've also had our fair share of mystical type experiences come about in the course of doing the psilocybin work for the smoking cessation. And prior research from our laboratory has shown that there are persisting positive effects related to these psilocybin occasion mystical type experiences, even at 14 months out from the experiences. And so 8 out of the 12 participants that have gotten through most of the active phase of treatment so far have had psilocybin sessions which meet the criteria for the mystical type experience according to the Pankey-Richards Mystical Experience Questionnaire. And some of these experiences, as I said, may have additional benefits outside of giving up smoking. And one caveat that we'd like to make is there's a kind of arbitrary cutoff there with whether or not something qualifies as a mystical experience, because the measure that we use, if you get a 0.60 score on your internal or external sense of unity during your experience, then that would count as a mystical experience. But if you're at a 0.59, then you don't. So, but it's useful for characterization and measurement purposes. And for instance, one of our participants, participant number 10, got a 0.59 for his first session, but he just made it at 0.62 for his second session. So we're glad to count him among the mystical experiencers. And so this next slide here is an example of what we would consider a mystical type experience. This was described by one of our participants in the course of his third session. Quite suddenly and without notice, the experience shifted. I was lost, all distinctions were lost. There was nothing, no time, no memory, nothing distinct, just total absorption. It was clear this was the point of the creation of existence. Unspeakable beauty arose. One could say majestic, awesome, glorious, etc., but I can find no words can get at what was revealed to me. There was a naked, pure quality that was so simple. The witnessing of creation, the emergence of all that is from nothing, the glory and magnificence of existence, of isness, moved me into an exalted state. Teeming with joy, jubilation for the preciousness of the gift of being. Wow, wow, wow. Yes, jubilation. I remember being filled with love at the awesomeness of life, of existence, of all that is. So again, this is outside the range of what you would consider normal, everyday kind of experiences. And it's kind of interesting because from our end, we're monitoring the situation and keeping an eye on the participants. And they seem to be laying on the couch. And then on the inside, this is what's happening. And when they come out to tell us this, it's always really amazing and very gratifying to hear that they've had such profound and potentially transformative experiences. And that's also reflected in the data that we are collecting. So one of the things that we ask participants after their sessions is, do you believe that your psilocybin experiences and your contemplation of these experiences have led to change in your current sense of personal well-being or life satisfaction? And as you can see here, most everybody said that it increased very much, which is a maximally beneficial response that we offer. And nobody said that their personal well-being or life satisfaction decreased after their experiences. So, of course, these are, again, positive results that we're very pleased with. So I know that I had said I was going to restrict my data set to the first 12 participants who are through, but I did get this from our participant who had his first session and quit smoking just last Friday, and I thought it was a great session report, so I really wanted to just include it. What he said, and this was a 37-year-old hallucinogen-naive male, so he's never had any experience with these kinds of substances before. And what he said was, this really was one of, if not the most profound experience of my life. Not only did I see God, or the one we like to call God, but I experienced the sense of unity and love like I've never experienced before. Not only could I see it, but I could feel it. I could almost taste it. It was thick and intense. It has changed the way I look at people, nature, life decisions, the difference between right and wrong. Cigarettes no longer feel like a part of my daily life, and my urge to be healthy has overtaken my urge to smoke. I saw my body being cleaned out of all of the impurities I've placed in it over the years, and I'd like to continue to keep it that way. So here we can see that there's actually some overlap, that sometimes these mystical experiences are also crossing over into the actual smoking behavior, and so that is also influencing the smoking cessation process in a positive manner. So in conclusion, our pilot data for the psilocybin-assisted smoking cessation program are largely positive, and they definitely encourage further investigation at this time. We obviously have more to learn regarding the psychological mechanisms underlying the treatment. However, we have found that many participants are reporting that they're having shifts in orientation toward the future, increased self-confidence, and reorganization of their life priorities and values, which have been coming about as an effect of their psilocybin sessions, and which have been helpful in quitting smoking. And finally, I'd like to leave you with this quote from participant number 6. So he's been smoking abstinent or smoke-free since December 6th of last year, which is about 4.5 months now. And at the end of his active treatment phase, he wrote us this little letter, and this is part of what it said here. I enjoyed the entire habit of smoking so much so that my 66-year-old body had smoked for 51 years. Psilocybin is that incredible dollop of magic thrown into the equation. In my opinion, the drug modifies your viewpoint of life itself in a good way. Truths are simplified, issues become transparent and manageable, life's values become more self-evident. Your individual reality is expanded. So, is there some unique defining point where the psilocybin whisks away a lifelong habit of smoking? I would have to answer no. I feel the Hopkins approach is successful as a result of combining a caring team of researchers with a comprehensive support system in conjunction with the psilocybin sessions. None of the 3 components would be as effective if used individually. And so we see here that it's not just the psilocybin doing the work. Our participants are doing a lot of the work by coming in and doing these, doing this deep exploration of themselves and what matters to them. And the cognitive behavioral therapy is playing a factor, and the social support is playing a factor. But we are finding, of course, that the psilocybin is giving us some excellent results. And again, this is encouraging us to move forward and to see how far we can take this. So. In conclusion, we'd just like to thank our funders at the Hafter Research Institute and the Beckley Foundation. And I would also like to thank our principal investigator, Matt Johnson, as well as co-investigator Roland Griffiths, and our research team, who most of which are here today. And I'd like to also thank our participants, and thank you for your attention. So.
We have time for one question. Oh, I saw your hand. Oh, no, wait, hers first.
Can you tell us the dose you're using in psilocybin, and also maybe compare it to what a typical mushroom dose would be, just so we can get a sense of what you're giving them?
We're using an ascending dose order. We start with a 20 milligram per 70 kilogram body weight, which is what we consider a moderate dose in our lab. And then we usually will move up to what's considered a high dose, which is a 30 milligram per 70 kilogram body weight.
Can you compare that to a mushroom gram?
3 dried grams of cubensis, 5 grams.
Yeah, it's about 3 dried grams of psilocybin cubensis for the moderate dose, and about 5 dried grams for the high dose.
How do the patient deal with the physical and psychological acute withdrawal from eliminating nicotine?
Well, interestingly, some of our patients or some of our volunteers have actually little or no withdrawal after their psilocybin sessions, and we again don't really know what's going on there, but we're talking about people who've been smoking a pack a day for 30 years, then just stop, and then they say that they're not getting antsy, they're not getting irritable, they're not having trouble sleeping. A lot of people actually do get a little nippish, they'll start snacking, but that's pretty much most of what happens for some people. Other people do struggle a little more, and part of the protocol is that we space it out so that the second session is 2 weeks after the first session, and that usually is a little booster, and that's a higher dose session at that point, to really kind of boost morale and get people cemented in the non-smoking. Also, I call all of my participants, or all the participants in the study every night after they quit smoking for 3 to 4 weeks, and basically just offer support, tell them they're doing well, and I think that seems to help as well. So they're generally coping pretty well, though. These are treatment-seeking individuals, so they're people who want to stop smoking. So, Thank you.